Welcome to part 4 of lameness in dogs. So today we're going to talk about the spine. And I wanted to separate the spine because there's a lot that we don't think about when we think about the dog and how the spine works. So first of all, to understand the spine, we need to know that they have 7 cervical vertebrae, and they're not easy for you to find, so I'm going to show you how you can assess those and see if there's any pain there. Signs for a dog that has pain in the cervical area will be a dog that doesn't want to shake. He'll kind of half shake or avoid shaking altogether, or he shakes and falls over. That can be a sign. Or they will hold their head in a funny position because they're trying to stop some sort of pressure that might be affecting a nerve. If it's something that's disky, so there are discs in between every vertebrae, and hopefully you can see that there's these little discs, and basically they're cushioning. But what can happen is if there's a bit of a pinched nerve or a disc issue, you may see some neurological signs, which I will show you on bend. But basically in the front leg you may see some what looks like limping. But if you see limping or a dragging of the foot a little bit, or you see them licking the foot excessively or licking sort of in their elbow area in here, that might be a sign that there's something going on in the neck, and I will show you how to assess that momentarily. So the next area in the dog is the thoracic spine. There are 13 vertebrae in the thoracic spine, plus they have ribs, and the purpose of the thoracic spine, other than helping them walk, is to protect. The ribs are protecting the major organs like the heart, the lungs, etc. And then the last part, where we see a number of issues, especially in older dogs and certain breeds of dogs, we see the lumbar spine. And there are 7 vertebrae in the lumbar spine. Again, they all have discs in between. And signs of lumbar pain in a dog, typically you'll see the dog kind of roaching his back. He's trying to alleviate some discomfort in there. Some of the things that you see in an older dog specifically is something called spondylosis, where we're getting some arthritis, for lack of a better word, growing between the 2 vertebrae, and they're starting to fuse, so it limits that mobility of the spine. Some of the other signs that you might see with some lumbar pain is a dog hesitating to go up the stairs. Now understand that that could also be coming from the back legs, but now that you know how to assess the back legs, you can rule that out or rule that in. And again, as I mentioned, they may be arching their spine. As well, you may notice that they're hesitating or won't jump on the bed or the couch or into your car any longer. If it's something a little bit more serious, like in the front limbs where you've got a pinching of your nerve, you may notice them licking excessively at a portion of their leg. If that's not normal for them, you may want to look or investigate further. No treats, no. So you may want to investigate with your vet a little further. Another area, not as many dogs that I see with this, but is the last vertebrae, L7. The next 3 vertebrae are called the sacrum. And there can be issues between L7 and S1. Typically dogs, you treat monger. Typically dogs that have pain in this, what we call the lumbosacral junction, it may be that they don't want to squat to urinate or to defecate, so they'll stand instead of doing that. So if we want to assess the neck, the best way to assess the neck is holding a treat, letting them lick it, or drool in his case, and you can bring the treat down. You can bring the treat all the way up, not enough that they want to jump up. You can hold the dog and have him see how he turns nicely. And we do it again on the other side, and then we give them the treat. Now, if you find when you're doing that that your dog doesn't want to go all the way down, What I see the most is dogs that don't want to turn their head in one direction, and that tells me that it might be a little bit sore. It's hard to assess the muscles in this area, or at least the vertebrae in this area, because there's so many muscles in around here that are protecting that area. So it is a little difficult. That test is the best way to check for neck issues. The best way to check the spine, you want to feel this, you'll feel this ridge on the top. And what you want to do is, goober on my hands. So what you want to do is, from this here is your scapula, so you can put your fingers on either side of that nubbly bit on the top, because those are the top of the spine, and you just feel your way down the spine. And I'm just putting a little bit of pressure, and I'm just seeing, is there anywhere, and I like to do this standing, and the reason I do it standing is because if there's any pain, and this is sort of probably mild to moderate pain, when you go to push down, you may see that your dog will consistently sit. Where I usually see that is from in the lumbar spine, which is, here's this last rib here. So this is the lumbar spine from here, and here's the sacrum there. I don't expect you to know exact anatomy landmarks, but that's a general idea. But you're going to just press down, just not too hard, and just assess, is there any pain? Do I feel anything? Can I feel any heat? So in the very first lesson I talked about using the back of your hand. This is a great spot to feel, is there any heat coming from an area? Oh, that was loud. So I'm going to go down, I'm going to go down, go down. It all feels good. And then we get to this little flat bit here, which is the lumbosacral junction, or LS or L7S1, and I'm going to push down a little there. And with some older dogs, when I push here, you'll see them like go and sit. It's like, ow, I don't like that. So that's two ways to assess their spine. So the other thing you can do, similar to the cookie stretch, is bring your dog right around again and have them touch his hip. Now if they don't want to go and touch their hip, or they just can't do it, it tells you that there's some lack of mobility in the spinal area. Now the last thing is, I mentioned disc issues or pinching of nerves. So if you want to check to see if maybe it's a disc issue or something neurological in the front or the back leg, is what you do is you just take their foot and you just turn it over, and you can see with him, like I can't even turn it over, like he's quickly putting it down. But with dogs that have very mild delayed reaction, especially in some of the really older dogs, is you go to put this over and it'll stay like that on the ground. So that tells you, it's called proprioception. So it tells you that the nerves aren't quite firing as quickly as they should be, and so there's a little bit of a deficit there. So if you have a young dog and you notice, this is, I call it knuckling, or it is called knuckling, if you notice that they can't turn their foot back over, that you may want to go to your vet and tell them that you did this little test and show them, and that should alert them that there's a possible disc issue in the, usually it's from somewhere from up here to down here, but most times it's between T13 and L4 is, L3 is typically where I see the issues. And you may see this in dogs that have the longer backs, like dachshunds or corgis, some of the beagles now, some of the coton de Toulouse that have the longer back to leg ratio. So I hope that that is helpful for you. And now you've got several different ways of assessing your dog and knowing what's happening in there, and that will help you when you have your vet visit. In the next video, we're going to talk about pain. So thank you for watching, and please like and subscribe and leave me a comment. I'm happy to answer. Take care.